it's me again. I'm Lena, and in this video I'll be talking about my main video, which is on the topic of what happens in a pediatrician's visit. Now, we have all been to a doctor's visit, and I think that most of us know what happens in a doctor's visit, or more specifically a pediatrician's visit, because that is my dream job. And so I've broken it down into 4 main parts and assessed each one individually and detailed. So in this video, I'm going to talk exactly about that. So the first part is identifying the symptoms. When my patient first gets into the room, I will need to observe them. I will need to identify what is wrong with them. So firstly, identifying the symptoms, there are 2 ways. The first way is to observe the child's behavior. For example, their irritability. Are they irritable easily, easy to irritate? Or do they have unusual sleep patterns or decreased responsiveness when I'm asking them? That is an indicator of them, of the unusual behavior. Another way to identify symptoms are physical indicators. So physical indicators can be things like rashes and increased work of breathing, or the patient cannot breathe very well or as easy or as normal as we would perceive them to be. There could be changes in urine output, for example, the number of wet nappies, and yeah, so those are the physical indicators in identifying the symptoms. The next part are the asking questions part. So remember that as a doctor or as a pediatrician, we need to ask open-ended and direct questions. Don't just ask yes or no questions. We need to ask open-ended questions so that we could get an overview of what the patient is going through or what they are experiencing. So there are 3 main steps that I have written down in my mind map here. The first one is initial inquiry. So initial inquiry is asking the patient. So these are broad, non-leading questions. So for example, what brought you in today? And so those questions could make the patient or the children feel more comfortable and also warm up to me a little bit so that they could be more comfortable when sharing their symptoms with me. The next step are the detailed questions. So these are the questions that I will need to press further. So these are the open-ended and direct questions. And I use the old cards, like the old cards method. And this is basically the onset, the location, the duration or timing, exacerbating and alleviating factors. So firstly, what is the onset? Well, the onset is when did that symptom, when does that illness, the signs of that illness start? Is it sudden or is it gradual? So those are the questions that I will need to ask first. Then the location. Where exactly is the problem? Is it in the body, or is it on the chest, or is it on the arms? So that is the location. The duration and timing. Is it constant, or does it wake them up? Is it constant, or does it wake them up at night? So those are the questions I need to ask both the parents and the child as well. And lastly, the exacerbating and alleviating factors. And so these are the questions, for example, what makes that worse or what makes it better? So those are the things that I need to ask for the second step, which are the detailed questions. And finally, the third step are the addressing concerns. For example, I need to ask explicitly to the parents. So I need to explicitly ask the parents on what are they worried about most in this sickness. So I need to, based on that, And also that will lead us to the third part, which is the gathering info. So gathering information, there are four main methods as well. The first one is the PAT, or the Pediatric Assessment Triangle. This will include work of breathing, circulation to the skin, and appearance. So those are the three main things that I will look for when the patient first enters the room, and this is a quick assessment without touching, and I will need to use my observation skills to use this pediatric assessment triangle. Secondly, the observation. I will need to have excellent observation skills in order to watch the child play or interact with the parent to see if there are any issues, are they comfortable or not, their general comfort, their social responsiveness, and their development. So I will need to assess those three main factors. Thirdly, the history taking. So history taking is medical records and things related to that. For example, the birth history, are they born premature, or what is their prematurity, their NICU stay, and then vaccinations, medication use, allergies, and their family history. So allergies are they are sometimes in patients they don't have any allergies, and sometimes they do. So I will need to ask them all about that. Finally, interviewing the child. So I will need to use the epistemic preferences. So for example, I heard that you have a tummy ache, or I heard that you have a sore throat. Can you tell me more about that, or point me to the location where it hurts the most? So those are the questions that I will need to ask the patient. So yeah, that is for the third step. And finally, diagnosing. After identifying the symptoms, asking the questions, gathering information, and diagnosing, gathering info, I'll need to make my conclusion and diagnose the patient with whatever that they are having. So there are also four main ways to diagnose the patient, which is firstly physical examination. So the PAT, use the PAT, or physical examination. I will need to examine the vital signs, check for the throat or the abdomen, the chest, the ears, etc. That is based on what the patient is talking. So based on what the patient is experiencing or going through. The second one is differential diagnosis. So this is basically creating a list of the possible conditions. That is the differential diagnosis. So I will need to consider the multiple possibilities, such as the viral infections, bacterial infections, allergies, or chronic conditions, and ruling out the most dangerous ones first, and then going down the list, ruling out each one. The third method is selective testing. So these are lab tests and medical imaging, but we only use this when it is absolutely necessary. So when it is medically necessary. So for example, the lab test could be urine, the blood, or swab test, and medical imaging could be x-rays, ultrasounds, MRI, etc. So that is selective testing. Finally, gut feeling. We all have that intuition, that gut feeling of when someone is lying or when someone isn't feeling well. So I will need to use my intuition, my nursing intuition or doctor's intuition, my gut feeling, to be able to see if the patient is experiencing that badly, or I will need to use pattern recognition as well. So those are the things that I have to say for my main video this week on what happens in a doctor's visit. So there are four main things. In conclusion, there are four main things that happens in a doctor's visit. The identifying symptoms on the doctor's perspective, of course. Firstly, I will need to identify symptoms, ask questions, gather info, and diagnose the patient. So those are the things that I have to say for my video this week. I hope that you have a great week learning medicine, and I hope to see you soon. Goodbye!